Hello, and thank you for tuning into Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, chair of the Division of Clinical Microbiology at Mayo Clinic in Rochester, Minnesota. With us today is Dr. Alicia Algeciras-Schimnich, a professor of laboratory medicine and pathology at Mayo Clinic and co-director of the Clinical Immunoassay Laboratory. So Dr. Algeciras-Schimnich has done a lot of work in the area of Alzheimer's disease, which is obviously something we hear a lot about these days, a very important disease. And she's going to talk to us about a promising new test. So Dr. Algeciras-Schimnich, thank you so much for joining us today.
Hi, Dr. Pritt. Happy to be here.
So let's just jump right into the information about a new blood test that we offer through Mayo Clinic, phospho-Tau 217. I hope I'm saying that right.
Yes.
Highly accurate in detecting a biomarker associated with Alzheimer's disease. And you were instrumental in bringing this test up. So can you tell us about the test, what it measures, and how it aids in the diagnosis of Alzheimer's disease?
Yes, absolutely. When we look at the changes in the brain of patients with Alzheimer's disease, one of the changes in the brain is the accumulation of a protein called beta amyloid. And this protein accumulate leading to plaque formation. And that plaque formation is what we eventually with other changes that happen in the brain leads to the cognitive decline and the presentation of Alzheimer's disease symptoms. The test that we offer, as you mentioned, the test is called p-Tau 217, and this is a blood test. And this blood test then measures or assess for the presence of this beta amyloid protein accumulation in the brain. So it is kind of an indirect measurement to look at what is happening in the brain of these individuals.
Yeah, well, thank you. It's a great background. And I had had the privilege of talking to Dr. Maurice a little bit about some of this new testing, but it's so great to have you here as the expert in this area. So it sounds like having a non-invasive test option is a major advancement. Like you said, it's a blood test, so it's nothing too invasive. What are the benefits of a blood test versus some of the other diagnostic methods that are out there?
Yes, so historically the diagnosis of Alzheimer's disease was a clinical diagnosis, and the specificity and the sensitivity was not very good for clinicians to be able to, diagnose a patient with Alzheimer's disease, mostly because many of the symptoms that you have in the early stages can overlap with other types of dementia, as well as with other reversible causes of cognitive decline. Then there were a number of biomarkers that had been introduced over the years, including amyloid PET and the use of spinal fluid to measure some of these Alzheimer's disease-related biomarkers. But both of these tests, the amyloid PET being very expensive and not available everywhere for patients to be able to access it. And then with the CSF, it's an invasive, the spinal fluid is an invasive procedure that many patients probably don't want to have to go through it either. So now having a blood test really increased the accessibility, allows for many more patients to be able to be tested and get really a definite diagnosis of Alzheimer's disease in a more streamlined process.
Yeah, that really is great. Alzheimer's disease has had heightened awareness recently in the general public. It's an important disease. What are the top things, in your opinion, that everyone should know about Alzheimer's disease and early detection, and why early diagnosis is so critical?
Yes, early diagnosis has become more critical in recent years because now we have disease-modifying therapies, and these therapies target that amyloid, that beta amyloid protein, so they are anti-amyloid therapies. And those therapies are very effective in slowing down, or are effective in slowing down the progression of the symptoms. So they're not a cure, but they allow for patients to have a longer life at better quality of life for a little longer. So when a patient presents with symptoms of cognitive decline, early diagnosis is critical, because then they can be started on these disease-modifying therapies or these anti-amyloid therapies faster. And the reason why that is important is because when the patients have mild symptoms is when these therapies are more effective. So now you can have, a better chance to be eligible for the drug, as well as have better success in slowing down the progression of the disease.
That does sound promising, being able to have that early treatment. And that's mostly because we have this better diagnostic now. How, in your mind, how does this test change the landscape of Alzheimer's research and treatment?
Yeah, the treatment is, is the accessibility, is that increased access. It's very easy, very low risk to get a blood test. So now people, both clinicians or patients, are more willing to do a blood test, because there is very little risk associated with it. So that has been a great advancement in the field. And then in terms of the research, even for clinical trials, we are starting to use these blood-based biomarkers as a screening tool to increase the effectiveness of patients, or the number of patients that can be eligible for a trial. They're still, in so many of the trials, they're still confirming the presence of that amyloid accumulation by other means, but by using a blood test, they really optimize the patients that are being screened by, or screened by another method. And in that way, they can, number one, increase the number of patients that are successfully recruited into the trial. And they can also lower the cost of that trial, because now you don't have to do an imaging test that is more expensive.
Well, that makes sense. Well, thank you for all this great information on a very important disease, and it's very promising having this more accessible diagnostic tool. Do you have anything else that you'd like to share with our audience today?
Yes, absolutely. I think something that we didn't cover is really what is the intended use population. And I just want to make sure that, as people are listening at how these blood biomarkers perform and how they're being utilized, they're really being optimized at this time to be used in patients that have symptoms. So patients with symptoms of cognitive decline. I know that, in other instances, there has been discussions about testing for these biomarkers in patients that are asymptomatic, because we know that the presence of that beta amyloid accumulation will happen years before the patient develops symptoms. But at this time, the clinical and the research community is not in favor, or is not promoting the use of these tests for asymptomatic patients. So really, at this point, they should only be used in patients that have symptoms of cognitive decline.
Yeah, that makes sense, as with many of our tests, and that pretest probability is so important for testing. So this is not something that everyone should go run out and get today unless they really meet the criteria for testing.
Absolutely.
Well, Dr. Algeciras-Schimnich, thank you again so much for joining us today. It was very informative, and we really appreciate you sharing your expertise with us.
You're welcome.
Thank you so much for tuning in to Answers from the Lab. Be sure to subscribe to this podcast, and don't forget to tune in every Thursday and every other Tuesday.